our healthcare has got a need now. We are in lack of healthcare personnel and time and everything. So I think the time is to be innovative.
Maybe we should have started this episode by defining what is digital health. Yeah. But I think I have my own definition. I think you have yours definition. That's a major discussion also in research environments. Oh yeah. And looking into the literature, if you want to see how the researchers define e-health, you can find more than 50 definitions of electronic health. Yeah.
Hello and welcome back to the Sustainable Healthcare Podcast. This week I'm back with Andreas and Pia from Roche Diagnostics. And in this episode we are diving even deeper into sustainability and how we use resources best in the treatment out at the hospitals and what works and what doesn't. So enjoy the episode. Welcome, Andreas and Pia from Roche. Super good to have you back here on the Sustainable Healthcare Podcast. Andreas, who are you in the brief version and what do you work with?
I'm a doctor working in Roche Diagnostics, Denmark, heading the medical and science department. And then I'm also working in a GP clinic in Copenhagen.
Very nice. Best of both worlds. That's how we like it here. And Pia, welcome to you too.
Thank you.
And what do you work with?
Within Roche, I work with access for the products to the market. And I have a title, Market Access Partner, but that means that I have a lot of dialogues with the healthcare system and people within Denmark, because we have to solve the issues together.
Yeah.
It's a partnership.
Yeah, that's a really good starting point and something that fascinates me about the healthcare industry, that everything is so interwoven, so no one can do it alone. And Pia, you're also working with sustainability, and in this episode we're going to have a discussion about both some of the initiatives that Roche are doing on sustainability, which I'm super curious about, and also a general discussion of how can we get more treatment and more sustainability with the resources that we have, because there's also a lot of constraints that we know when we're working in the healthcare industry. It has to be safe, it has to be efficient. In a lot of healthcare systems, there's a shortage of clinical personnel and warm hands, and they say, so it's not easy to go out there. So what are the sort of dialogues that you're having with the healthcare systems on these issues? And how do you do it?
How do we do it? Actually, we are a team of colleagues, and we sit down and look into what is the situation in healthcare. If we look into Danish regions, Denmark, together with some other Nordic countries, has just made a report regarding sustainability and the packaging and the circular economy instead of the linear economy. And we have had a lot of dialogues with the purchase departments to find out how can we solve this issue together. Representing a company where we have a lot of huge instruments, small instrument, point of care instruments at the GP side and the municipalities, home care places, with having samples with tissue and blood and so forth. We need to look into how can we do it better. Can we automate some different areas? And for us, sustainability is not only the environmental factor, it's also the economic and social impact. And we need to protect our future to meet the goals.
It's a very good start, and I think what you're mentioning it also with the Nordic Packaging Initiative and other things, and also what we're seeing from the procurement departments in NHS from the UK and the Danish regions, that sustainability on all the different areas you mentioned is becoming a part of healthcare in a very serious way, and also in slowly becoming a co-deciding factor of what purchases are being made. So could you give us some examples maybe from some of your dialogues at a high level on how does this conversation take place? How do you work together on doing things smarter and more sustainable?
Actually, we're talking about what does Roche to make this a sustainable environmental practice.
Yes.
And we have, using our products, we have a large quantities of waste.
Yeah.
And we also operate requiring high volumes of energy and water consumption.
Yeah.
And we're also using substances to the lab machines of very high concerns. And also complex supply chains. And it's important to think about the biggest CO2 reduction can actually be obtained from optimizing the supply chain. So packaging is only 8%, less than 8%. So we really have to have it in the helicopter perspective to find out what to do. And in Roche, it is actually part of the DNA of Roche to protect the environment. So we have some goals, both global and in Denmark as well. And globally, we have a goal that, and I can say it here from the papers, 50 reduction in environmental impact of our operational products from 2019 to 2029. Reduction in our greenhouse gas emissions to real zero by 2050. And we work towards going beyond the regulation to phase out, it's called the SVHCs, from our products, and also partnering with suppliers to reduce the greenhouse gas emission. Because if we don't partner up, we can't reach the goal.
No, definitely not. And that's also what the procurement departments at the other end are seeing, that 85%, something like that, of the CO2 emissions of a hospital, for instance, lies in the supply chain, in what we also call scope 3 outside. So they need to work together with you, and you need to work together with them, and also with the suppliers. And so
let me take an example.
Yes.
We have a product with troponin T is the name, that you can have a blood sample in the ambulance telling if you have what that's called a non-STEMI, the kind of heart attack you can't see on an ECG.
Okay, yeah.
Then you can take this blood sample in the ambulance, and within 12 minutes you have an answer if there is a heart attack or not. That has to be treated.
Wow.
So instead of taking the ambulance to the local hospital, where the patient will be for some time before they will refer him to the right place where they can do the surgery and so forth, you have the answer right in the ambulance and take the patient to the right place at the right time. And that's also sustainability. You save life, you save heart, and you save the environmental impact.
Yeah.
Just to give an example.
No, that's amazing, and I mean, time is definitely of the essence when we're talking heart attacks. So, and I think that's another great example that efficient treatment is inherently sustainable, and because I think there's definitely a lot more focus on sustainability in the healthcare industry now, even though companies like Roche and others have been working in it in different ways for a long time. It's gotten a refocus, and a lot of people and companies are, but we also, the patient comes first, and how do we do this and still being safe and efficient? And I think it's a great example that you're giving, that just providing more resource-efficient treatment, smarter treatment, often is the best way to go. So how does, when you say it like that, it seems like a no-brainer that should be implemented. But how do you then go out and take that dialogue with the healthcare systems and the procurement departments that say, hey, we have something new that's smarter, it's good for the patient and the environment, and how a lot of our listeners might be sitting in other places of the value or treatment chain. How does that work?
Actually, I think that our healthcare has got a need now.
Yeah.
We are in lack of healthcare personnel and time and everything. So I think the time is to be innovative.
Yeah.
We have different examples of products that have all the evidence and everything from different medical societies and so forth that has not been used.
Yeah.
But I think they are listening now. Okay. And both Dansk Erhverv, Danish industry, the medical industry, I say it in Danish, it's more in medical industry and so forth, everyone are working together now to solve the issue. Okay. And I see that we have a much more common effort to reach the goals, and a lot of things and are set up now to reach the goal, both for the healthcare situation and the environment as well, because I think it's a part of what we're doing.
Yeah. No, definitely, and I think that's a very good point, that we see that in everything from cooling solutions or logistic solutions to treatment as well, that having the solution is not enough. No. It's just the first step. We need to implement the new technology and get it out there.
So you're asking how. We do have places in the medical industry, and we talk to Dansk Erhverv, Dansk Industri, and the regions. And I think we work together now, also with the government, with the life science strategy and so forth. We are moving fast now.
Yeah, that's really good to hear.
Faster.
Faster. Yeah. I mean, you would always like things to be done yesterday. Andreas, you're working together with Pia, of course, but also have a very much a digital focus on digital healthcare, and I know it's a personal passion for you as well. What are some of the ways that you see that digital healthcare can help with sustainability?
Yeah, so we've just, I was about to say we've just been through a pandemic, but maybe it's coming back, I don't know. Yeah. But as all of you know, there have been a pandemic, and in that pandemic we learned to work in new ways. Yeah. Because it was required. So the example I can give is in the GP clinics where I've been working. They need to change their way of working from day to day. Yeah. And that meant that we had to deal with patients virtually. Yeah. Because the patients were not allowed to come in the clinic. Yeah. And that was a major change.
That's a big change in the clinics. What did that?
It was a major change, and it was a change for the physicians and the healthcare professionals, but also, of course, for the patients. We learned how much we can actually do over the phone. Yeah. It's a really good technology, and it's
brand new technology.
Yeah, well, no, not at all. But it was actually interesting to see how much you can actually do over the phone. Yeah. Of course, there are things that you miss when you don't see and feel and can do your things on the patient. So of course, it's different, but there is a lot of quality in a simple phone call. Yeah. We also suddenly got video calls and video consults, and that was interesting. And of course, it's a major change from the whole the patient has to come to us, and that's a big change. Environmentally speaking, also, of course, because they have to drive down. Some places you have to drive really far to come to the clinic, and some patients cannot themselves drive, and that's another issue. But we save a lot of time and CO2, I would say, from going to only physical to maybe digital first, or at least have some sort of virtual care filter, where you learn what patients can you do, can you help virtually, because that's also good for the patient. And I think it's so also with the example of pushing diagnosis to the ambulances, for example, it's very much about value-based healthcare.
Yeah.
So that everyone involved actually has value from what you do. And I think that's number one thing you have to consider when introducing new technology or when doing innovation.
Yeah.
Everyone has to gain from this.
Yeah.
And we have seen some really bad examples. I call it own goals. Yeah. So when you sort of so we have seen something that were introduced that was really good for the patients, or really good for the data, or really good for research. But yeah, sometimes I've lacked that that saying that okay, it has to be good for everyone involved. Yeah. And that it is possible. Yeah. It is possible.
Yeah, that's a great point. That I think we're going to do an episode on value-based healthcare as well. We're actually working on a scientific paper on how to integrate environmental sustainability into value-based healthcare as well. So to also make the planet a partner in that equation.
And another way where digital health can help, and I mean. Maybe we should have started this episode by defining what is digital health. Yeah. But I think I have my own definition. I think you have yours definition, because it can be very broad. Yeah. It can be super broad. Is it your smartphone? Is it your social media activities? Is it your shopping activities, as we discussed? What is health data and what is digital health? That's a major discussion also in research environments. Oh yeah. And looking into the literature, if you want to see how do researchers define e-health, you can find more than 50 definitions of electronic health. Yeah. So that's just mind blowing.
Yeah, we had that issue with the health data in the report, and ended up choosing a broader definition that also included a lot of non-clinical data, because we found that to be important.
Yeah, and I'm pleased that you did that, because it is important. But so with that really broad definition of digital health, you can also, meaning including the telephone, for example, right? Just come back to this more simple, older technology that's actually really beneficial. You can see that by reducing or changing the pattern that you see, that you have outpatient clinics, that you don't have to have a fixed schedule for patients coming in twice a year or yearly or whatever, you can actually save a lot of time, save a lot of patient and physician time, and you can save a lot of CO2, etc. It's really a fantastic example of value-based healthcare, I would say. Yeah. That when you go from the one-size-fits-all plan to a more flexible, more precise, or maybe more personalized way of doing healthcare. It's not only in the hospital; it's also in the primary care that we have to do more precisely and don't do one size fits all, because patient can come maybe twice a year or maybe one every decade. It depends on what patient it is. Yeah. And we learned at a hospital in Denmark that by changing that, you can actually reduce, I think it was 40% of the outpatient times, so appointments. Wow. So that's a huge number. That's a huge number. Just thinking about time saved from in the hospital and from the patient and on the roads and so on. So it's a great example. Yeah.
Yeah. So even your work day in the GP clinic becomes different as well. Because now it becomes an interwoven mix of video calls and calls.
Yeah, exactly. And digital health can actually help that transition from a fixed plan to a more flexible one. Yeah. Because we can have the patient report things to us. Yeah. So if you follow a patient with eczema or pain or whatever, they can send the weekly pain assessment or whatever to us electronically, and we can maybe have flagged, okay, who needs attention now? Yeah. So digital health can help us find the patient who needs us now. Yeah. And that's a very, very important step.
Yeah, you could say it's a data-driven healthcare system, like Andreas says.
Mm-hmm. Yeah. And Pia, before this episode, you mentioned something really interesting about a dialogue you had with a healthcare system on using one machine rather than 10 different machines or something like that, which goes a bit to a value-based healthcare point as well. Could you?
That's actually one of the areas of action for us. We are looking on waste management, sustainable purchasing, innovative partnership, and so forth. And we had a situation in a region where we were out talking with the government people there, and we had made a picture of the region and telling them how many instruments they had. And the other picture we said, what are the need for you with the needs you have within your region? And that's a part of the dialogues we have with them, that we are also taxpayers and we want to use the system and the healthcare resources as good as possible.
So they had a lot more machinery than that was actually needed?
Yeah, you could say they could decrease with 8 machines.
Yeah.
So that was an example.
And still have the same health output? And
exactly the same, and they could be owner of their data, the different departments, and that's also a part of our dialogues, how to use the resources in the best way.
Is that because we have learned to combine different use cases into fewer machines, or because some of the others have become obsolete, or what were sort of some of the underlying reasons for being able to reduce with 8 machines?
That's the way we work within the company, and the way we want to work and be seen as a company.
Yeah.
So that's actually a part of the DNA in the company. What do you think, Andreas?
Sure.
Yeah.
Yeah. Okay. Yeah. Very cool. Yeah, because I mean, it comes back to value-based healthcare as well. That rather than thinking, okay, how do we get the cheapest blood sample, then looking at how do we get the most health throughout the system, and for all partners, as you said, per dollar, and not just on the individual savings on the device or component.
And we also look into the supply chain, as I mentioned earlier.
Yeah.
And what I think is important, the hospital look at their logistics. We also do. We have changed the way we are packaging to more environmental packaging. We have a smart logistics system picking the right boxes at the right time, and the way we package and send it to the hospitals. And our focus internally is also that we have decreased our trips and the flying trips with 80%.
Wow.
And we are changing our car fleet to electrical vehicles and so forth. So it is a focus area.
Very nice.
For everyone.
It's
but we can't do it alone.
No.
We have to do it as teams with all the different institutions and so forth.
And I think that's a major point, that we cannot do it alone. Also coming back to one of your previous episodes about heroes versus systems. Yeah. Hero could also be a company. So Roche cannot do it alone. We have to have the right structure and the right infrastructure and the right system to play with. Yeah. And it's crucial. I mean that the rules are set up to help us drive the sustainability that we would like to do. Meaning procurement rules and tenders, that they are built in a way that actually makes sense for us to focus on in a way that we want to.
Yeah, and that's a huge challenge out there that luckily more and more procurement departments are working seriously with this, trying to write it into tenders, making sure that you get points in the tender for, but it's still a challenge how to do it and how to do it uniformly. Some of the procurement departments we've had dialogue with, and then they put in maybe that you need to have a life cycle assessment or other things, and then for some of the things there's not industry standards yet. So the answers that they get back from the suppliers, from Roche and others, will be very different. So there's a lot of dialogue that's needed. Is that dialogue going on out there?
It is going on. I think we have a lot of dialogues with different health care stakeholders, and we have. If I talked about our footprint, but we also have our handprint, and we have a lot of projects going on.
Handprint, could you explain that to our? Is that how many clinical persons?
That's the positive consequence of our presence, so to speak.
Okay. Yeah.
And footprint is when you stamp. What are you doing to the
to the earth? Yeah, I like that. Yeah.
So we had a lot of different projects that we had working with together with not to say customers, but the partners. Yeah,
because that's, and I know, at least from a Danish context, where we have some good dialogue with the procurement departments, they need you guys in the industry to come and say, well, this doesn't make sense, or how about this, or when you did that, that was really good, do more of that. And because I think a lot of people in the industry, they want this, but they want it to be in sort of even playing field that makes sense, so that but of course, the more ambitious you are in your sustainability strategy, the better you're also going to be positioned when it becomes part of the tenders.
Hopefully. Hopefully, because I mean, it also sometimes it comes with a price. And that's a really interesting discussion. So what are we willing to pay for a more greener solution? I don't have the answer. I'm just throwing up the question. Because I think it's a really, really interesting point. Also looking at tenders and previous tenders, how much has the price to say, so to say.
And it's a good question, and I think it's also I think a really interesting point is, I know from one of the Danish procurement departments, they did 20 pilots where they really put sustainability into the tender. I'm thinking that's the numbers, as we recall. And I think 18 of them, they had the same economic frame. So for a lot of them, you are able to have the same sort of pricing, but for some of them you're not. And maybe when you're not, maybe we should just say that, okay, well, that's a focus for later. That's too complex to solve now, sustainability-wise.
If that's the numbers, 18 out of 20, I think that's a good starting point.
That's what was there for them, for those. I mean, maybe there's also a bias towards low-hanging fruits.
That's a good place to start, right?
And we have also started a project at one of the hospitals looking at the waste management from the big laboratory machines. What can we do to change it? The reagents that you put into the machines, we have changed it that you lose less than before. So it is a focus area all the time. What can we do better? Also for the people working at the labs. The economic and how much should they take and the weight and so forth. So it's a total picture.
And we also, so Pia and I were both so lucky to participate in a workshop some weeks ago with Choosing Wisely, the Velklogt initiative.
Really good work.
It's an interesting thought to see. Okay, what are we doing in the healthcare system that's not necessary? And they had a focus this time on what sort of lab tests can we avoid taking, or why are we taking sometimes too many, other times too few. But we need to be better at and that's also back to the health data and the whole sharing of data, because if I take a blood test on someone in my clinic, sometimes if they are referred to the hospital, and then they will have the same labs when they come in.
Exactly.
So that's way of working. That's sort of a workflow schedule, but also a health data issue.
Definitely.
And the law to share the data between sectors. It's so important that it follows the patient. It's the patient's data.
No, that's a great point, and you have. If you break your leg skiing in Norway and you need to get it done up there, I mean, there's a lot of data that won't follow you. And even within countries, when moving from one healthcare system to another, there's also a lot of times where the clinical personnel doing the procedures will not have the full picture if it's a different healthcare system.
Or maybe they can get the full picture, but it will take them a tremendous time to find the right data, because it is connected in many ways, but sometimes it's not nicely done. So you have to go through several web pages and log into this, and then you can find and then click on the. So
it's almost the same as not being there in a stressed environment with too few clinical hands.
Exactly. Another thing that we're also doing in Roche is to take from all of those point-of-care devices we have and other point-of-care devices in the laboratory, the small laboratories in the GP clinics. Yeah. We are taking all those data and put them into the system. And maybe it sounds simple, but it's not done now. Meaning in my clinic, if I take some sort of test on a patient with a throat pain or cough or urine pain, whatever, some sort of pain, for example, I take a test and I get the result, I write it on a Post-it or on my hand, or I remember it and then I go back and type it in. Maybe I type it in, maybe I don't type it in. Yeah. So that's a total waste. I mean, okay, it could be part of my diagnostic process leading to some sort of treatment or maybe some sort of
just in a data bank for general purposes.
Yeah, exactly. But maybe I'll take a test and the patient go to the hospital and they don't have the data. Yeah. So it's not maybe on a national level, but sometimes also on one clinic, the data doesn't transfer all the time. So we have built a solution where we can take all the data and put them in the system in the right place, and that's a huge help.
Nice. And that's also, I'm just going to plug some of our older episodes that if you're listening out there and working in a lab or working with labs, we had the really good episodes with Nicoline Bergman on sustainable labs, and also with Malte from how to automate lab equipment.
Exactly.
I was baffled with when he told me that for most research in labs or other kind of tests, the results are still written down manually in a notebook or typed into a spreadsheet for a lot of the things, which it's both cumbersome, but it also just gives a huge room for error. That of course you're gonna type something wrong at one part or write it down wrong or.
But for many years that's been a thing for Roche, building more fully integrated and fully automated solutions. Yes, exactly. So that's not a Roche solution you're talking about.
No, that's definitely
no. I think what Malte and his team has done is that they've made a device that you can plug into any machinery. And then you can connect it and have a uniform platform, so you're not dependent on having siloed from different vendors. Yeah, you should probably talk to Malte. He's a great guy. Cool. I think one last thing I'd like to talk about is the thing you mentioned about the deliveries and the packaging, because we see that as a very big problem across hospitals, that they're getting way more deliveries than are needed. So you will have some kind of surgery done, and after the surgery is done, the nurse will go in and reorder what was used in the surgery. So you will have a delivery every day rather than having it once a week or sometimes many times a day. Warm hands needs to open those boxes and put it in. And is that a problematic that you see as well?
I don't see it within our area, but I'm aware of the fact with the surgery and so forth. But it goes two ways. Yeah. It goes for the purchase departments, the clinicians and the operating theater, and the deliverer or the firma.
Yeah, the delivery company, the logistics company.
I know that from our point of sight, I have talked to our colleagues within the industry. They often say, "Oh, could they order better?" And that's actually a process that has started. I think everything is better now. If you have a knee transplant, in the old days you opened the package and it was different from ward to ward and hospital to hospital. Today they try to synchronize it and find the right things in the packages and so forth. And I think if you have it in that way, it will solve time issues, because if it's the nurse, she knows this is the package, I only need this, and I only need that amount, because she knows often how many knees they are making and so forth. So I think we are in a trend and process that it's becoming better, everything, because we have a need. And the need has evolved the situation.
Yeah, definitely.
Does it answer that?
Yeah, no, I think that was a very good answer. So, thank you so much for coming. If you had to give one key reflection, Andreas, from our talk here to our listeners, what would that be?
So boiling it down, I think, so a major point for me is the definition of digital health and definition of health data. Think about how do you see health data, and maybe try to challenge that. And also, whatever you do, make sure it brings value to everyone.
Yeah, super good reflections. Thank you. Pia, how about you, if you had to take one key reflection or key takeaway for our listeners?
Is that everybody needs to think about sustainability and take their action into saving the world in the future.
Right on. Woo! That's a great exit point.
Wow, that's perfect.
I can really stand behind that. Yeah. Thank you so much, Pia, and thank you so much, Andreas. It was really a pleasure having you, and I learned a lot, so it was really nice.
Thank you to you too.
Thank you so much for listening. I learned a lot from this episode. That's one of the best parts about my job. I'm constantly learning new things from smart people in the industry. If you also learned something in this episode, please share it with a friend or colleague. We are actually proud of the work that we do here, and we would love to share it with more people. Also, so we can get some more speed on the green transition in the healthcare industry. Have a great day out there and take care.